this video, we're going to talk about acute pancreatitis. Acute pancreatitis is a condition where the pancreas becomes inflamed or swollen over a short period of time. This may occur at any age, but peak in young men and older women. But in chronic pancreatitis, the pancreas has become permanently damaged from inflammation over many years. Etiology of acute pancreatitis. Remember as I get smashed. Iatrogenic or infantile such as cystic fibrosis, gallstones, ethanol, trauma, steroids, mumps, autoimmune disease such as systemic lupus erythematosus, scorpion bite, hypercalcinemia, hyperlipidemia, hyperparathyroidism, hypothermia, ERCP, drugs, azathioprine, thiazide, cyclophosphamide. Patient with acute pancreatitis complains about severe, sudden epigastric pain, cramping in nature, radiates to back or shoulders, nausea accompanied by repeated vomiting and retching, lasts for hours or days, aggravated by fatty meals, relieved by leaning forward. Signs are tachypnoea, tachycardia, hypertension, mild fever, features of cholangitis, tenderness in abdomen and distend, Gray-Turner's sign, Cullen's sign, pleural effusion in some cases. Investigations to diagnose acute pancreatitis evaluate serum amylase, serum lipase, and perform a contrast-enhanced CT scan. To assess severity, utilize the scoring systems such as Ranson, Glasgow, and Apache 2 scoring systems. To exclude other differential diagnoses and determine etiology, do an ultrasound for gallstones and ERCP if gallstone pancreatitis is suspected. Additionally, consider an erect chest X-ray for perforated peptic ulcer or pleural effusion and an abdominal X-ray for signs like the sentinel loop, colon cutoff sign, and renal halo sign. As treatment for mild pancreatitis, intravenous fluids, brief fasting, pain relief, antiemetics can be given, but no antibiotics needed. For severe acute pancreatitis, ICU admission, pain relief, fluid resuscitation with oxygen, invasive monitoring such as central venous pressure, blood gas, NG drainage and enteral feeding, antibiotic prophylaxis if necessary, and ERCP within 72 hours for severe gallstone pancreatitis. Complications categorized as systemic complications add local complications. Systemic complications may include shock, arrhythmias, acute respiratory distress syndrome, renal failure, disseminated intravascular coagulation, hypercalcemia, hyperglycemia, and hyperlipidemia. Acute fluid collection, pancreatic necrosis, abscess, pseudocyst, ascites, pleural effusion, and portal or splenic vein thrombosis are local complications of pancreatic disorders. Thank you for watching. Subscribe for more videos.